Hello students, good morning all. In this video, I will continue to
The medication error on the model classification explanation. Yeah. Okay, there are four type on the medication error by the model classification. The first one is prescribing errors. Yeah, and what type of this error? Okay, this error is occur at the stage of prescription in order or order writing. Yeah, so in prescription and order writing. Yeah, so it will be error due to an authorized prescriber. Yeah, or prescription error. Yeah, it can be selection or regimen error. So actually these prescribing errors it involve the physician or the prescriber to prevent this error. And what is the role of the pharmacist? Pharmacists have an important role to remind and make any confirmation to the doctor or physician to revise or maybe to change the regimen or drug selection. Okay, the other example is error due to dosage form. Yeah, maybe there are some error when you see or read the prescription due to dosage form. Yeah, for example, it should be injection, but the written prescription is tablet, maybe. Yeah, okay. The other example, the other example is error due to untreated indication and unnecessary drug use. Yeah, and the two last example is have a relationship with DRP. Yeah, or drug-related problems. Yeah, sometimes we see in the prescription there are medication without indication or inappropriate medication because of unnecessary drug use. Yeah, okay, this is some example of prescribing errors. Yeah, I give you some example. For example, it's wrong dose. Yeah, wrong dose when the pharmacist prepare the cytotoxic drugs. The carboplatin dosage is substituted with cisplatin dosage, so resulting in severe toxicity. This have published in publication in 19 and 98. Or wrong patient. Yeah, wrong patient, because in Indonesia we have maybe in board. Yeah, some patient have same name. Yeah, in Bandung, for example, Asep. There are a lot of people with name of Asep or Agus. Yeah, so you should check which Asep. Yeah, for the prescription. Yeah, okay. Okay, this is the sample. Can you read what kind of drug written in this prescription? I read fastin. Yeah, anyone? Maybe you have any idea about the exactly the name of medication is Vasotec. Yeah, I see Fantin. Yeah, but the doctor intend to use Vasotec for the patient. Yeah, so this is dangerous. Yeah, if prescription is not clear. Yeah, or unreadable. Okay, the next step is transcribing error. Transcribing error is error in reading prescriptions or error due to different dosage form from the prescribed or order. Yeah, in a reading process and different dosage form. Okay, and the third example is dispensing error. Dispensing error is the error that occur during dispensing process. First one, if you prepare the damaged drugs or wrong preparation or in dispensing process. Yeah. Okay. This is the example of the medication error that have been published in some journal. For the dispensing, for example, any labeling errors or poor drug storage practice. In poor drug storage practice, the potassium chloride is stored in a cupboard next to sodium chloride, so it can be confusing. Same of chloride, but the one is potassium and the next one is sodium. It can be affect the patient electrolyte. Okay. Or there are also the example labeling error. The key information is not clear and not recorded on the drug package prior to it being dispensed to the ward or patient, or this is labeled incorrectly by the pharmacist. Okay, so sometimes you prepare the medication or prepare the etiquette in the same time. So if you remember on the basic pharmaceutics, Bu Lucy have teach you to prepare step by step. To dispense drugs step by step. Why? Because it's important to prevent medication error. Please remember what Bu Lucy teach about this. Okay, and how about the medication administration error? The administration error is the error that occurred during the administration process or when you give the information and how to use the drug. Okay, error in administration technique. It can be wrong route. It can be wrong site of injection or wrong procedure or wrong rate of administration, or error due to a failure in receiving drug or maybe ignorance to drug administration. For example, drug not available. It always occurs in Indonesia because of some drugs kosong, empty in the stock, national, even it is sodium chloride solution, because of the system. Sometimes we don't have any sodium chloride in the stock. So this is also the administration error. Or patient cannot afford the drug because of the price maybe too high or too much expensive. Or nurse forget to administer drugs. And the next example is dosage error. Maybe it make a patient confused when you write the etiquette and do not explain more when the pharmacist give the instruction to the patient. And then the ADR, the error can be also occur when the pharmacist have known the first drug reaction that have performed by the patient, but pharmacist skip or forget to inform the patient, and after that patient got the ADR. The other example also error due to drug interaction, pharmaceutical interaction or pharmacology interaction. And the next part is error due to non-compliance. Actually, this compliance is a patient problem. But pharmacists should prepare the counseling for the patient that need high compliance in using the medication. So there are also error if the pharmacist not explain or not guide the patient to comply with the medication. Okay, this is an example. There is an old patient or geriatric patient with age 76 years old. He or she prescribed diltiazem slow release for hypertension. So pharmacists give the wrong administration or wrong instruction, how to use the drugs, and or maybe patient can forget how to use the medication. But I think this is the important point, that if you have the very very important information, please write and give the patient warning on the etiquette, or maybe you have a card and you write the instruction on the card. It should be slow. It should be swallow, swallow, not chew the drug, But in this case, patient chew the drug, so this pulse is going down slow, and patient died. This is harm, and dangerous for the patient. Okay, this is another example in administration process. Okay, you can read on the slide. For example, wrong road, vincristine or vinblastine. No, wrong road, vincristine or vinblastine administered intrathecal rather than intravenously. So the administration and the volume distribution is also affected by this wrong road. Okay, this is the last part of segment 2 in the medication error, and I will continue to the next lecture material about how to prevent and how to analyze this medication error. Thank you.